UT Health Austin has started a new program to help patients with lingering symptoms of COVID-19, often called long haulers. Joining us now to talk about this is Dr. Michael Brode, Medical Director of UT Health Austin's post-COVID-19 program. Thank you so much for being here.
It's a pleasure. Thank you for having me.
Dr. Brode, first, what is the criteria for someone to be classified as having long COVID?
That's an excellent question, and the short answer is there is no consensus criteria put out by the NIH or CDC, and actually it's one of the first areas of research that all doctors are really looking into. But for most people, we do consider that COVID, the initial illness, can last up to 4 weeks. People can have persistent symptoms up to 12 weeks or 3 months. But we kind of consider people long haulers or having post-COVID syndrome after they are still having new or persistent symptoms at 3 months.
And what are some of the more common symptoms?
Yeah, the big ones that we're seeing a lot are fatigue, what we call post-exertional malaise, when people exert themselves physically or mentally and feel extremely tired from it, headaches, having persistent shortness of breath or problems with the heart rate. And then for some people who have been in the ICU or hospital, seeing some lung scarring from the illness.
Now, there are other programs like yours in Texas, but this is the first one in Austin. How common is long COVID, and about how many patients are enrolled in your program?
Yeah, so it's tough because the scientists each measure what long COVID is differently, but we expect that people will have lingering symptoms at 6 months in around 10 to 30% of people who have the initial COVID-19 illness. So it's a big range, but a lot of people going through this out there. So far in our program, we've been able to see about 60 people going through this in our clinic at UT Health Austin.
And what is the program's approach to treating patients dealing with long COVID?
Yeah, so we really take a holistic approach. We want to think about, what people have gone through, what their recovery plan is, and making sure we also address their mental health and social health too, because COVID has been such a strain on everyone, especially the ones not getting better. And so we have a couple approaches. First of all, we don't want to replace the primary care relationship that patients have. And so we really want to work with either primary care physicians or the patients themselves to utilize that existing relationship on the path to recovery. We want to make sure people are getting good physical therapy or in a graduated exercise program, that we're treating their mental health stressors or their economic stressors. And then, of course, be on the cutting edge of the research and science and treatments, which as this new disease is coming forward, we're just on the vanguard of right now.
So if you are someone who has long haul, if you're a long hauler and you want to get in touch with your program, how do you go about doing that?
Yeah, we'd recommend people go through their primary care physician. We do recommend that they just get a general health checkup, make sure this is all long COVID and not, a complication of diabetes, heart disease, something else that's common. The primary care physicians can refer patients to us directly.
And if you would like to learn more about UT Health Austin's post-COVID-19 program, we do have a link on our website. Dr. Michael Brode, thank you so much for sharing your time and expertise with us tonight.
Thank you for the opportunity.